Chronic illness or health, it is a choice. It's not luck. It's not chance. It's something that we create. We create our environment every day through our choices. We literally decide to have enough water or not enough water. We either decide to have good food or we don't decide to have good food. We tend to make these choices at each and every meal we make, and that's what our makeup is made of, are these choices that we eat. There's a quote that I want to give you that's by John Knowles, who was on the Rockefeller Foundation Committee. He said, "The next great impact in the health of the American people will be determined by what the individual is willing to do for himself." Now hear that. The next impact in the health of the American people will be determined by what the individual is willing to do for himself. We can't look to others to fix us after we're broken, or we're going to constantly be broken. Have you ever known anyone who is constantly ill? If it isn't this health problem, it's another health problem. I see things all the time, like chronic fatigue, fibromyalgia, diabetes, high blood pressure, high cholesterol, high triglycerides. These are all, as I term them, pity-potty diseases. These are diseases that people choose to have. You know the old saying, if you always do what you've always done, you'll always get what you've always gotten? Every 4 days we have that new stomach lining, every 28 days new layer of skin, every 16 months to 18 months a new body. So here's the choice. Have you ever noticed that these people that are chronically ill always have some type of an attention-getting thing going on? Many times it's a payment for them. They feel that they need that to get attention. How sad that is. You see, health is all about a mindset. One day you decide to do something different and you receive a different effect. So if we're going to change small things in our diet, we can change our health. When you go to the doctor, it shouldn't be a prescription for high blood pressure. It should be, are you eating too much sodium? Are you eating too many dense caloried foods? Are you putting on excess weight? Are you not exercising enough? Is your blood too thick? If you have high triglycerides, are you eating too many carbs, too often, too close together? Are they the wrong types of carbs? Do they digest easily? Don't they digest easily? If you've got high cholesterol, are you eating too many dairy products? Are you eating too many fried foods? Are you taking in any unsaturated fats, such as olive oil, safflower oil, sesame oil, that are cold pressed that can lower these types of fats? Fish oil can lower these types of fats. We have all these problems. You see, when somebody is chronically ill, there's a chronic problem, and that chronic problem starts with our self-will running riot. In other words, these people are making these choices consistently, and if they can't get the attention one way, they'll get it another. And if they don't remedy this problem, even going to the doctor, if they don't start on a program of restoration and revitalization and repair to their body, they're going to be put on a drug. When they're put on this drug, it's going to mask the symptom. The trouble with the drug is the minute the symptom goes away, most people feel they're fixed. But what they've had is a masking of the symptom. The symptom's gone, but the problem exists. That's why they need another medication down the road. So to avoid those other medications and to avoid those other things that they're going to have happen to them, they've got to change their base of eating, how, when, and why they're going to have. So if you're not going to change and you're not going to change your mindset, and you're not going to look into the knowledge that you can get to make these changes, you are going to be chronically ill. And if you're chronically ill, we shouldn't be buying into you, nor should anyone. If we really care about someone, we should wake them up and ask them, what kind of a payment are you getting for these chronic illnesses? After all, no one has to have. At 13, they told me that my heart valve was bad. Within 3.5 years, my heart was totally better. Why? Through herbs and a change in nutrition. It helped me to live 50% longer than the average male in my family tree. And you can do the same thing. Every possibility for you to stop being chronically ill is within your power. You can take charge. You can learn the information, you can apply that information, and you can realize it. Look at some of the rest of our videos, check out our testimonials, and you can be one of those people.